Why is it important to listen to this program? Because communicating with someone suffering with Alzheimer's, especially as the disease advances, can be challenging and uncomfortable. Yet it's so important to communicate both verbally and non-verbally. For this, my third program related to this subject, I'm looking for easy to understand practical examples of how to communicate to make the lives of Alzheimer's patients, their caregivers, and family and friends a little brighter. Please stay tuned.
Welcome to The Better Part, a program by and for seniors and devoted to exploring the many facets of those better years of our lives. The name of our program was inspired by a quotation from Robert Browning. "Grow old along with me, the best is yet to be, the last of life for which the first was made."
Currently, there are estimated to be 5.3 million people with Alzheimer's in the USA, 480,000 in California alone. The odds are that you or someone you love will have Alzheimer's. It's a cruel disease, and communicating or knowing just what to say can be hard with people without an illness. So how do we communicate with someone with Alzheimer's? I'm Val Jeffrey of The Better Part, and today my guest is Dr. Judith London, a psychologist and author of the book Connecting the Dots, Breakthroughs in Communication as Alzheimer's Advances. Welcome, Judy.
Thank you so much, Val. It's great to be here.
How important is our demeanor when we're talking with Alzheimer's patients?
It's key. It's key for any human interaction and for any human relationship. Because actually, when we think about somebody who has Alzheimer's, as if just that person is a regular, precious human being, we approach that person the way we would want to approach anybody we'd want to meet or relate to for the first time and then afterward. With kindness, a smile, friendliness, and wanting to find commonalities so that you can relate together.
Should the questions be specific or open-ended, and what are some icebreakers to get us started?
Open-ended questions have been shown to produce better results than simple yes-no questions. So it's always good to reserve the simple yes-no questions if you need to find out if someone's in pain, for example. Otherwise, a simple, "How are you doing today? What's it been like so far?" And I should also add that you always need to introduce yourself, especially with an advancing Alzheimer's patient, because that way the person can, at least for the moment, know who you are.
So if we do ask them, "How are you?" will they really tell us?
In my experience, absolutely. For example, I had one patient who, when I approached her for the very first time, not knowing her, and she didn't know me, and I asked her how she was doing, when I finally got her attention, she just quietly said, "Not well." And then I looked at her and I said, "Not well physically?" And I used my hands as a nonverbal communication, as a gesture. Or not well mentally, to find out if something had to do with her way she was feeling. And she answered me with both. So then, when I said to her, "Wow, that must be tough," I asked an open-ended question, "What do you think of this place that you're sitting in?" which happened to be an open ward in a hospital. And she began to give me the longest discourse about the various people who were around. And I didn't really understand what she was saying when she said, "That one over there doesn't understand you. Don't ever go there for any kind of help. That person over there, that's the chief cook. That person over there, that person comes to sit at the tables." And it made no sense to me, until I realized that for 25 years she had been working in a restaurant, and I saw that she saw the place as a restaurant dining room. And I said, "This is a restaurant dining room, isn't it?" And she lit up and said, "Yes, And she found a way to make sense of her confusion, and she saw that we'd made a connection.
And all this came from just saying, "How are you?"
Yes.
People tend to ramble. They go to one thing, it's like they're seeking in the computer and they're grabbing at things. What do you do when someone tries to do that? Can you harness them in, or how do you handle that?
Well, that's exactly what happens in Alzheimer's, is the neurons are no longer sending messages to each other because they've been blocked in between. But there are ideas and pieces of ideas still in people's minds. So the important thing to do is you, as the person who can figure things out, you do the connecting of the phrases and ideas for the person. And viewers can just come back and say, "Do you mean that this, and this?" And the person will look at you and say, "Yes," with relief if you're right. And also say to you, "No," if you're wrong. Because people with Alzheimer's have an uncanny sense of what's right and what's wrong when it's spoken back to them.
So if they do say something incorrect to you, and in my experience, Alzheimer's patients they come up sometimes with things that just aren't true. Do you actually correct them? Do you ignore the question? What do you do?
Any utterance a person makes is an attempt to communicate. Study after study shows that if you correct someone with Alzheimer's when they're trying to communicate, you immediately stop the communication. I mean, I often think that what we really need is empathy. How do we feel when someone corrects us? Are we always open and saying, "Thank you for that wonderful feedback, I'll do it a little bit differently this time"? Or do we sort of step back and sort of get a little annoyed? Even if we might be wrong, we're thinking, something's wrong with that person if they think what I'm saying isn't right. Well, the same thing happens for a person with Alzheimer's.
That can put us in good stead for other people too, children, and just generally in our life, not just for Alzheimer's patients though, right?
Absolutely. The thing about someone who has Alzheimer's is this is an individual who has a disease, not a brain disease as a matter of fact, but not someone who's a demented person whose thoughts, comments, and behaviors are to be totally ignored or minimized. We are to treat people with Alzheimer's as the people they really are, as people first who have a disease.
Some people are quiet, and sometimes you can go to make conversation with someone and you can't get through to it. If someone is quiet, does it mean that they don't want to communicate, or should you keep trying?
It depends. If this person was a very quiet, self-contained person her whole life, why would she suddenly start talking now that she has Alzheimer's, which is interfering with her ability to communicate? However, if this was a person who did normal interactions and communications before, absolutely it's important for us to reach out, because Alzheimer's prevents people from initiating actions and initiating talking and initiating communication until their back is against a wall, in which case they might do something which seems totally inappropriate, coming from the frustration of not being able to speak what's on their minds.
And repeating, Alzheimer's patients sometimes repeat themselves. If we repeat ourselves, do they realize that we're actually asking the same question again?
Well, repetition is a very interesting area. How do we, all of us, learn? By repetition. We study for tests, we look at the same thing over and over again, we repeat it to ourselves, we quiz each other, and then sometimes we have to take a test about it. Well, people with Alzheimer's will tend to repeat themselves because they didn't remember they just said it, and they didn't feel satisfied with what they heard after they made the first comment, so they're repeating it again because it didn't register or answer the question that really was in their hearts.
So they're getting annoyed.
Absolutely. So when they repeat themselves, listen to what they're saying. That's the key. Those phrases are not just mindless phrases. It's an attempt to say something, to communicate a thought when there's a breakdown in a connection. So you again have to put that together for them by connecting it for them and delve underneath it. why would someone who wants to say, "Where is my mother?" over and over again, and this person who's asking you is 93 years old herself. So why would she be asking that? She must have her mother on her mind. So you begin to say, "Do you miss your mother? Tell me about your mother. Was she really a good cook?" And then they begin to get engaged because the thing they really want to talk about is their mother and not you. As far as your role in repeating yourself, you can get away with it because the memory loss is so acute. First, recent memory goes in Alzheimer's, and then more immediate memory goes, which means not remembering a minute later. So if you repeat something, people with Alzheimer's won't necessarily get angry with you when they're in the advancing stages. They may appreciate hearing it again because it gets them back on task.
How do I handle unrealistic demands, such as, "Can I come home with you?" How do you say no compassionately to unrealistic demands?
Well, the key is this. Someone wants to go home, and the ideal kind of response is, "I know how much you want to go home." You acknowledge the feeling, of course that person wants to go home. You validate it so the person isn't left hanging with this thought that people are trying to distract him from. But then you start talking about home. What is it about home you miss? Tell me more about your home. And that helps make that sad kind of, question into something that's a meaningful interaction.
How about news and television? Sometimes we sit down and we watch the TV and there's fighting and not nice things happening. Does that disturb Alzheimer's patients, or should you figure out what things they should watch and they shouldn't watch? What's your input on that?
It really depends. First of all, there are some differences between men and women, the way they communicate, even under normal circumstances. And men typically love to listen to the news. I know it's stereotypical, but I'll put it that way. Very often like sports events. And furthermore, use that information to relate to other people. They certainly use it to relate to other men and to bond that way. So keeping them away from what's going on in the outside world really is a denial of something that they would love to hear about. And there are many women who just love to hear about the news and want to stay up for that, 11 o'clock news broadcast. So I think it's very important to use the television wisely, knowing what you know about the person. If that person never liked listening to the news, why should that person be listening to the news now? But if that was a person who was always actively into it, definitely do it. And you don't want to overstimulate someone with too much commotion, because a person with Alzheimer's will experience the news as it's happening in the moment around them.
Right, that was my point. Are there any subjects that should be avoided? Are there things maybe from their past life or something that we know we shouldn't get into?
I would say that it's important to take the lead of what the person wants to tell you. If, for example, this person had gone through a war, and if the war had been very devastating and they had some devastating experiences with it, and then they start talking about the army or about the war, that's absolutely fine, because it's like unfinished business. We all need to talk about things that bother us. And people with Alzheimer's need to talk about the things that are distressful, including forgetting, losing one's way, feeling sad and depressed, feeling lonely, as well as feeling joyful.
Is there an ideal amount of interaction to actually be meaningful to the patient?
I think that there are certain times of day when it may be a little bit harder to engage someone with Alzheimer's. there's one condition called sundowning, which is literally as the sun goes down, it becomes exhausting. The mental processes start to dull a little bit, and there's less patience. They get tired. I know for me, 5 o'clock, I am not at my best. I need to get through that little loop, and then I get fine afterwards. But for people with Alzheimer's, very often, 4 or 5, 6 o'clock, they start to fade a little bit. So you might find that it's better to speak to them earlier in the day about meaningful things. But otherwise, always reach out for connection. Some of it won't be as meaningful in terms of meeting together mind to mind and heart to heart. But there's a lot of other connecting you have to do during the day, even regarding basic skills of living, like washing up. And talking to the person and including the person and telling the person what you're about to do really fosters communication and cooperation. So it doesn't take them by surprise.
If someone's distressed and agitated and you want to make conversation with them, what's the best approach and what's the best thing to say? How do you reassure somebody? How do you get started talking to them?
I think that if a person is being very aggressive, I think at that point the person really needs some space. And I'd say make sure that you have safe space, because sometimes in the frustration of not being able to express oneself, a person with Alzheimer's will lash out. And you want to make sure that you're safe no matter what.
So if they are like that, then the best thing would be probably just to say, I can see you want some time alone, I'll come back a little bit later.
Absolutely. You need to always announce what you're going to do and include the person as a person, the way I would say to you, gee, excuse me, I have to leave for a couple of minutes.
Right. Can anyone communicate, or is it really the family that do the most good?
Anyone really can communicate. The advantage of the family is that they know the history, whereas newcomers don't know the history quite as well. I used to approach my patients. They didn't know me from anywhere, but they began to realize I was that lady who had the kind face, who had the nice smile, who was always interested in them. And maybe they thought I was somebody from their past. It didn't matter, because in that moment, and people with advancing Alzheimer's very much live in the moment, because that's all they can remember is the moment. They get it, and they feel very good about it. So you don't have to know the person very well if you approach the person the way you would any new person you're about to meet.
What about children? From the perspective of the patient and from the children, is it good for children to have conversations?
Children are wonderful. They bring back wonderful memories. They're, as well as being soft and lovely and being very inquisitive, and people who have had children and grandchildren in their lives love children. Even people who've never had children seem to love children. The Alzheimer's Association, which is a wonderful resource, and it's national, and we have a great local chapter. The Alzheimer's Association has all kinds of downloading handouts, as well as things they will mail you about how you can deal with your children who have a grandparent, for example, with Alzheimer's, and how to explain it to them. And there are some wonderful, lovely books that describe this in the words that are meant for children to read, and children get the message. Children can be wonderful.
You mentioned that men and women like different subjects, sports, etc. But do men and women have to approach the patient differently or not?
I really think you approach the patient very, very similarly. However, like when I would approach a male patient, it's another thing men love is jokes. And I had one patient who loved to tell me a joke. It was the same joke. I must have heard it 100 times. But he remembered that joke. And every time he told me the joke, I just laughed because it was an adorable joke.
I hope it wasn't a dirty joke.
Not too off color. So jokes were really a great way to approach it. Now, when I would approach a woman, I wouldn't necessarily start with a joke. So if I know something about the person's background, that determines how I'm going to approach the person. Men, women, it didn't matter.
Well, we've talked a lot about verbal communication. With nonverbal communication, when do you know when the person doesn't want to talk, they just need their hand held? What vibes do you get? When should you sense that?
I think that people need to always ask before touching, because some people who have Alzheimer's might interpret touching as an intrusion.
Okay. So I should have said, may I hold your hand?
Yes. Is it okay with you if I hold your hand? Can I pat you on this shoulder?
Yes, you may.
Can I link my arm with yours and we could take a little walk together? That way it's not a surprise, because someone who I perceive to be a stranger links his arm in mine and starts walking with me, I'm going to fight.
Right.
I'm not into doing that. However, this lets them know what's going to happen next.
Is it really necessary to understand Alzheimer's disease in order to communicate?
I think the most important thing to understand is it's progressive. It's very gradual onset. It is irreversible, and gradually it affects every area of a person's functioning. What's important to know about Alzheimer's is the connections are broken among brain cells, between brain cells, to cause a problem in communicating in any way. But it's also important to remember that our unconscious memory, even with someone with Alzheimer's, is the very last memory to fade. Our memories are stored in many different places in our brain. And people who have Alzheimer's still have feelings, and they also have fabulous instincts. They always know the good guys from the bad guys, especially if that was something that they were really sensitive to earlier. So memory of an unconscious nature remains. And another important thing is people with Alzheimer's are still capable of learning new things. We don't usually focus on it, but if you focus on what's left in someone's brain and the fact that new brain cells are being made every day, whether you have Alzheimer's or not, as studies are beginning to show.
Do these techniques work with other dementias or not?
Yes, they do. Because I used to work with people in groups who had different dementias, and very often an Alzheimer's type dementia is mixed with another dementia. Because once there's an assault on the brain, let's say from a stroke, there's a higher probability of getting an Alzheimer's type dementia. So many people have a mixed dementia, especially as Alzheimer's progresses. These same techniques really work.
Did you always know how to communicate with Alzheimer's patients, or what turned the light on for you?
My kind of training is in counseling psychology, which is a little different from clinical psychology, although the license is the license. In counseling psychology, the philosophy is look at what's right in someone, not what's wrong with someone. This is in the early training. And in clinical psychology, you're always asked to look for what's wrong and get the diagnosis of what's wrong. So I came from a philosophy of look what's right in someone, use what's right to make things better and to offset the problems that they're having, and let them use those strengths to deal with those problems. So I came from that philosophy, and I must say that I approach patients with Alzheimer's the way I approach every single patient that I've ever had, even when I worked with teenagers way back when.
Why is it so important to encourage Alzheimer's patients to talk to us?
People who have Alzheimer's are people. They are trapped inside by the impaired communication. The frustration builds, and they become more isolated and withdrawn from everyone and from the world around them. When a person reaches out into that world, they become alive again, and you see it on their faces. None of us wants to live in isolation. People need people. And just because you have Alzheimer's, just because you have cancer or some other kind of disease, you still need each other. And since people with Alzheimer's can't tell us by saying, hey, I need you, we have to reach out and say, we understand that you need us, and we want you too.
Well, that leads us nicely into your book.
Okay.
What inspired you to write it?
I used to run group therapy with people with advancing Alzheimer's. Now, this is not usually done with people who don't have any memory, not only don't recall something from last week, but from the last minute, and who never really knew my name or knew my title. I would meet with them for an hour a week, various groups of people, and we would talk about anything that came up, even the hard subjects. And they responded, because a group, really, the sum of the people in the group is much less than the whole. The whole group is greater than the sum of its parts. Just like it is, we all need to be in groups. We're in community groups. Well, people who have advancing Alzheimer's need to be in a group. And when they sat together in that group, all of a sudden the light bulb went on. They knew that this was something special. So I could not get over the brilliant things they told me. The brilliant things they told me about depression. The brilliant things they told me about what it's like to have lost your memory. The funny things they told me in very clever terms. And I was so impressed with this that I said this message has to get out. People have to know that if they reach out, they will actually get wonderful responses. And maybe the relationship isn't what it used to be, but boy, it sure is there of what it can be and still is.
This is all wonderful information, and we've come to the end of the program.
Oh.
It's a good complement to our two other programs, Is It Alzheimer's and Diagnosis Alzheimer's. Alzheimer's, Talk to Me. And I would like to give you a few minutes here to leave a final message with our audience. What would you say?
Oh, the message is clear to me. When you reach out to connect with someone with Alzheimer's, that person will reach right back to you, and you will have found a connection, and you'll be able to communicate. Just believe that it can be done.
Yeah, connect the dots.
That's what you need to do.
Thank you, Judy.
Thank you. Pleasure.
If you would like a copy of this program or any of the Better Part programs, please contact us at the Cupertino Senior Center, 408-777-3150, or visit our website, www.thebetterpart.com. A selection of our programs are also available through the Santa Clara County Library System and on YouTube. I'm Val Jeffrey for The Better Part, and I thank you for watching.